And that's different. Because we really need to be open. And we're talking about...
Okay, hi, I'm Dr. Meredith Labarda. I'm the chairperson of the Department of Medicine at the University of the Philippines, Manila School of Health Sciences. I'm also the lead for the Social Innovation in Health Initiative, SIHI Hub, and also the Global Network Secretariat. Both of these are hosted at the University of the Philippines, Manila.
I'm Hannah. I am the Hub Manager of the Social Innovation in Health Initiative, or SIHI Philippines Hub.
My name is Abigail. I am part of the SIHI Philippines. Currently, I am one of the research associates for one of the gender projects. But for this workshop, I am a participant.
For this workshop, this is part of the partnership of SIHI, or the Social Innovation in Health Initiative, with UP Manila School of Health Sciences and Maastricht University through the NUFIC grant. This is on comprehensive sexual education and gender issues specifically. So it's sort of like a training of trainers for faculty and some medical students whom we hope after the workshop what they learned would be translated into something that can help the communities come up with a comprehensive sexual education and gender issues program that would help the adolescents specifically in either in the communities or integrated in the curriculum and the curricula of the school where we are at.
Initially, I didn't have an idea at all of how this workshop will be. This is our first face-to-face workshop, the first one in 2 years, because we started this project in 2020, I believe.
So we've had a total of 4 workshops already. There was an introduction to gender, then a workshop on intervention mapping, on community engagement. We also had short workshops on social media and how to use that to campaign for sexuality education. And then now we're having this specific on gender issues and comprehensive sexuality education. So
remember that we met in August and September as well. Then we focused on intervention mapping. And we had a total of 5 workshops, and we participated in step 1 to 5. Try to add or try to think of interactive elements. Start where the people are in terms of needs. So really try to develop initiatives that meet these needs.
So far we've had gained a lot of tools and skills already in how to, specifically the ones that we got on community engagement, intervention mapping, and also the use of social media.
When we did this during the pandemic, is we were able also to put into consideration not just the face-to-face platform to do this, but because we are in the middle of the pandemic, we also thought of how would we do this in the context of the new normal. So people were sharing many of their challenges and their even their innovations. So it was a learning experience for everyone in different communities and in the different sectors that each one represents. So for the strength of this workshop, we're able to gather the faculty and even the medical students who are now deployed in this community that we are working at. So whatever we learn from this workshop, we hope to share this and to cascade this to the community and implement a program that is co-designed with the community. This is a diverse group. So we have participants from the academe, we have student participants who are also in their young almost middle age, but most of them are in their 20s. Some of the participants are also municipal health officers and managers in their respective local government units and local health systems. We also have participants from the Social Innovation and Health Initiative, and that's very important because SIHI would also be the one to collate all of this, and we hope to put this into a manual for trainers who will be interested also to design a workshop or a program that's similar to what we are doing.
Now, this specific workshop is like the more technical part of it, the one that really introduces us now to gender issues and comprehensive sexuality education. This has given us insights, first of course regarding the concepts on gender and sex, the gender stereotypes, etc. And also on different ways and strategies on how to approach and how to deliver comprehensive sexuality education. It has given us also different examples from globally, from around the world, on how to conduct or what are the different interventions that have been working already in different parts of the world.
I came into this workshop really wanting to learn different types of strategies that other countries may have done in developing their SRHR programs. I think it's very helpful for us to learn what other countries are doing and see whether or not we can apply those in our communities here.
Now it's the next steps are to really put them all together. But for this specific workshop also, one of the successes is that we were able to pilot or to apply some of the lessons already and tools and strategies in a community activity yesterday.
So we visited the community to be able to have a first conversation with community members, specifically the adolescents. We wanted to be able to get their thoughts and initiate a conversation about sexual health and reproductive rights as well as gender issues within their community. It was important as a first contact with them to not only engage the health workers but also the adolescents themselves. So we were very happy that we had participants from the Sangguniang Kabataan or their youth leadership of the community with us. I think one of the most important things we have learned is that the most important voices that need to be heard are those of the youth. So there is no such effective program without having engaged them first. So it's very important to go into the communities, really learn what are the issues surrounding gender, surrounding sex and reproductive health that are important to them specifically. And these might change from one community to another. That is why it's very important to speak with the adolescents where they are within their space so that we are able to learn from them.
My aim and goals in this workshop is first to educate myself about gender and sexuality issues on different perspectives. Then second is to educate the community people, especially the adolescents, regarding on gender and sexuality issues that they may encounter. And lastly, to become a change agent in our gendered society through this workshop.
The purpose of the workshop was to get the team and those who were part of the training to learn more about SRHR related to gender positioning, and all that for the purpose of reducing the teenage pregnancy high rates and HIV spreading. But the next step would be to use, for the group, to use all this new knowledge or the knowledge brought together by different people and through this learning together into a manual that can be used in the future for a long period of time to facilitate and help new people coming into this field how they can work in the most practical and most effective way towards comprehensive sexuality education, covering gender-based violence prevention, covering HIV prevention, covering teenage pregnancy, in the larger picture of helping the young generation to become happy and healthy adults.
Yeah, you have to stand on one leg, otherwise. Transmitted diseases, the activity design, but actually how it is meant to be. Yeah, thank you.
Cancer na talaga or
Actually, I'm going to
Okay, wag gagalaw. Kita programa ginihimo adolescent sexual reproductive health. Ang parte naman
Okay, si tita, si ate, si nanay, siya si tatay.